name is Matheis, and I'm going to be presenting my LEND project, which was looking at co-occurring mental health concerns amongst youth with autism spectrum disorder, as well as the relationship with these concerns with social functioning. Just a little background about this topic. So autism spectrum disorder frequently co-occurs with a lot of different psychiatric disorders. So these include things like anxiety disorders, depressive disorders, oppositional defiant conduct disorders, as well as ADHD. We also know that these occur at higher rates amongst individuals with autism spectrum disorder compared to the general population. And there's also been some research indicating that anxiety disorders and ADHD, when co-occurring with autism spectrum disorder, lead to increased social deficits as well as increased behavioral problems. So the specific aims of my study were to examine the co-occurrence of autism with parent-reported symptoms of anxiety, depression, conduct problems, and ADHD amongst school-aged children. And then I also wanted to see if this comorbid psychopathology was related to differences in social functioning. So I had two main hypotheses. First, I hypothesized that these comorbidities would be at higher rates amongst the ASD sample compared to the general population based on previous research. And then I was also hypothesizing that symptoms related to ADHD would be predictive of lower social functioning, also based on previous research. So the methods were, I used a secondary data set that was acquired from the AIR-B study, and this was looking at school-aged children who were participating in social skill intervention. And they were at 4 different sites across the United States, in Los Angeles, Baltimore, Seattle, and Ann Arbor, Michigan. And so these kiddos were participating in social skills intervention through their school, and they also had their autism diagnosis confirmed through ADOS assessment. I was primarily looking at 2 baseline measures that were administered. The behavior assessment system for children, which is a parent rating scale that looks at, it's a broadband measure, so it looks at a wide range of different symptoms and difficulties that young children might be having, and it's based on parent report of these symptoms. As well as the social skills improvement system, or the SSIS, and this was completed by teachers at baseline. And this is a measure that looks at general social functioning, how good are their social skills, as well as things related to problem behaviors. The statistical analysis was fairly simple. I was looking at descriptive results related to the psychiatric comorbidities and the symptoms. I did some chi-square analyses to examine the relationship between comorbidities. And then I was also doing linear regression models to look at the predictive value of these comorbid co-occurring conditions with social functioning as well as problem behavior. So in this sample, I had 131 children. About 80% of them were male, and the age range was between 6 and 11 years old, with a mean age of around 8. The IQ also had a pretty wide range, so the range was between 58 to 139, with a mean IQ of around 92. And then the sample was fairly diverse as well. So there was a good representation of children who were Asian and Hispanic, and then a few who identified as other and African American. So this is a breakdown of the prevalence of co-occurring mental health problems that I found within this sample. And this is based off of the BASC. So scores that were in the clinically elevated range is what I was using to see if there were these co-occurring mental health problems. And so this is interesting just because you can see that a good number of children within the sample, about a third of them, had elevated ADHD symptoms. And then you can also see broken down next to that in the blue bars, this was related to specific types of ADHD, so inattentive, hyperactive, or combined, and so you can kind of see the breakdown there as well. This next graph compares the prevalence within the ASD sample to statistics found from a general population study that was done using the 2016 National Children's Health Survey data. So this is parent report of clinical diagnosis, and this was a national sample. So those are the blue bars, and then the purple bars are the ASD sample. So you can see here that children with ASD they had much higher rates of some of these conditions, such as anxiety, depression, and ADHD. That depression difference, I think, is particularly interesting, just because there's a significantly higher proportion of kids with ASD showing these symptoms. But it's also important to remember that these are symptoms being compared to a clinical diagnosis, which may not be the best comparison to make. This next graph shows the elevation of symptoms within the ASD sample. So this is looking at the rates of elevation within that clinically elevated range, which is in purple, but then also those who had elevations within an at-risk range. So the difference between these is pretty small. So to be in the clinically elevated range, you need a T-score of 70 or above, and within the at-risk range, it's between 60 and 69, so pretty close in scores. And you can see that the majority of children in this sample were having a lot of mental health concerns across the board related to all of these symptoms. This is a breakdown just of the number of co-occurring mental health concerns per child within the sample. So the majority of children in the sample didn't actually have elevated concerns on any of these disorders. However, about 32% had one, about 10% had two, and 3.1% had three areas in which they had elevated concerns. In looking at relationships between these comorbid symptoms, I found that anxiety and depression were related, inattention and hyperactivity, and then hyperactivity and conduct problems. And all of this is pretty much what we would expect based on knowing the relationship between these symptoms. However, what was interesting is I also found a significant relationship between hyperactivity and depression amongst children with autism spectrum disorder. In looking at social functioning, I found that greater inattentiveness was related to reduced social skills. And this was interesting just because results related to hyperactivity were not significant, as well as results related to ADHD as a combined category. So specifically, inattention was related to reduced social skills. In relation to problem behavior, I found that depression and hyperactivity independently predicted increased problem behavior. And again, similarly to before, it was hyperactivity here that was interesting. So not inattentiveness and not a general diagnosis of ADHD, but specifically hyperactivity that was being related to problem behavior. So some conclusions. So I did find that children with ASD in this sample did have high rates of comorbid anxiety, depression, and ADHD. The majority of participants in this sample did have elevated symptoms, though, and I think that's important to consider just because there might be a lot of overlap between symptoms as well as related problems in autism spectrum disorder with these other psychiatric disorders as well. I also saw that depression was found to be related to increased externalizing behavior. So this was the problem behavior. And I think this is really interesting just because a lot of time we talk about depression as being a disorder related to internalizing problems. And we know in young children that a lot of these problems end up being externalized, right, in problem behaviors. And this may be particularly true for individuals with autism spectrum disorder. I also thought it was really interesting teasing apart the difference between inattention and hyperactivity in terms of how that was impacting social skills. So finding that inattention was negatively impacting social skills, but hyperactivity was increasing problem behaviors. There were some limitations to this study, so the reliance on parent and teacher report for measuring symptoms and social functioning is obviously a limitation. I wasn't able to do direct assessment for these symptoms, but I think more largely how we assess these disorders within autism spectrum disorders a limitation as well. We don't necessarily have great measures for that. And then also to mention elevated symptoms does not equal a clinical diagnosis. So some children who may have had elevated symptoms may not meet full DSM criteria for some of these diagnoses. There were a few strengths that I wanted to highlight. It was a community-based sample, so not a clinical sample, and they did have a pretty wide range in IQ, which is unusual for a lot of symptoms or a lot of studies on children with autism. I think further research is needed to look at the impact of co-occurring mental health concerns, as well as the impact on treatment response. So that's actually the next step that I'm going to be doing with this data set.
The UC Davis Mind Institute was created in 1998 with a promise to find cures for neurodevelopmental disorders. Every day, our physicians and researchers come closer to fulfilling that promise. Their groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other brain disorders are helping children achieve their fullest potential. Please visit our website to find out more about current studies, upcoming events, and how you can help make a difference.